So here is your question. Right, so if you have read and understood, considering it critical care scenario, kindly please tell me, how would you manage this old lady?
Okay, I will manage the patient according to care of critically ill surgical patient.
Good.
Start by secure the airway, put the patient in high flow oxygen, and make sure it's good breathing. And after the check the breathing, the pulse oximetry, and also to check ABG, and then go for circulation.
Yes.
I will put two large bore cannula and
Yes.
take a blood sample for CBC, LFT, or coagulation profile, and urea creat, and all of this. And I will start check the vital sign of the patient. Here, blood pressure, respiratory rate, and capillary fill time. And also I will put urinary catheter, and
Yes.
I will check the mental I will check all of this. After that, I will start fluid resuscitation. Patient hypotensive. I will give the patient bolus of 500 ml of crystalloid as a fluid challenge, and also I will check the response of the patient. And also I will prepare cross-matching blood for the patient.
Okay,
And
good. Can you tell me what differential diagnosis would you consider for her, for this patient?
okay, it could be acute diverticulitis, or
Good.
diverticular abscess, or ruptured diverticulum, or also could be pelvic inflammatory disease,
Very
and
good.
also could be ischemic colitis, and also
Could
could
even
be
be
inflammatory bowel
sigmoid
disease,
volvulus.
sigmoid volvulus, or
Considering there is
toxic megacolon also.
very good. Okay. Right. How would you correct the ABGs or arterial blood gases of this patient, as she
Okay,
is suffering from metabolic acidosis?
okay, I will give the patient fluid,
Yes.
and also I will give the patient I think sodium bicarbonate to like enhance alkalosis, and I will enhancing the breathing to watch out the CO2, and
Okay.
what else? I will give I would treat the electrolyte disturbance. Most probably have electrolyte disturbance with this metabolic acidosis.
Yeah, good. Considering the symptoms which patient is exhibiting, under what type of shock is patient undergoing or going through?
Patient going to septic shock.
Very good. So can you define the term septic shock?
Okay, it is a failure of circulation due to it's life-threatening condition, like circulatory failure, cannot meet the tissue and the organ demand.
Yes.
Like cannot meet the oxygen requirement for the tissue, or utilizing the oxygen.
Okay. According to the NICE guidelines, how should a septic shock be managed? What are the basic principles that you should follow?
Okay, I will follow sepsis 6. I
Okay.
will take blood culture,
Yes.
and also take blood culture and urine sample. I will put a catheter, urinary catheter,
Yes.
and give the patient empirical antibiotic after take the culture, and give the patient oxygen, and also Also give the patient supporting fluid.
Okay. Which nutritional support you will give to the patient?
Okay. Now the patient like severe ill, I give the patient TBN with
Yes.
partially interim feeding to prevent
Okay.
bacterial colonization.
All right. Okay.
Or
In order to confirm your diagnosis, just suppose you've performed a CT scan and it comes out to be confirmed or positive for the presence of diverticular abscesses. What are the management options that you can offer to this patient?
Okay, according to Hinge classification, I would treat the patient. If the patient in class 1 or class 2, like precolic abscess or pelvic abscess, I can go for subcutaneous drainage and then toilet and give the patient antibiotic. If the patient have stage 3 or 4, there is peritoneal, there is peritonitis in the abdomen or fecal peritonitis, then I will go for surgical treatment, open or and
Image guided.
incision and drainage
Okay.
abscess and good toilet of the area and
Yeah.
put the drain and by open surgery, and if need for resection like Hartmann
Wait,
resection.
if I can please interrupt you for a second. What are the disadvantages of doing open drainage in this age group?
Like delay the wound healing.
Yes,
and also scarring
high
and
morbidity.
high
Forget scarring.
morbidity.
80 years old, 78, she doesn't care about the scarring. High morbidity. So what is
Okay.
another alternative that you can offer?
Can go for subcutaneous drainage by guided CT scan or ultrasound. And
what would be the disadvantage if you offer the image guided aspiration?
it's like not good toilet,
Yes,
not complete
not
evacuation,
adequate.
and also cannot put stoma. If
Very
you want
good.
to put a
Very,
stoma,
very good.
we can.
Excellent. Excellent. All right. Okay. Can you tell me this patient has 10 ml of urine output in the last hour? Can you tell me what might be the reasons for oliguria?
Okay, patient hypotensive now
Yes.
and in the septic shock.
Yes.
It could be due to decreased renal perfusion and
Okay.
lead to acute kidney injury, and
Yes.
also maybe the stress response of this condition,
Yes.
oliguria. And but my main cause like dehydration due to
Okay.
metabolic acidosis also.
Patient undergoing metabolic acidosis and also with acute renal injury or acute kidney injury. Can you please tell me, mostly patient will present with hyperkalemia. How would you manage or what would be the clinical relevance of the management of hyperkalemia in this patient?
Okay, hyperkalemia most concern like arrhythmia on the heart. So I will start by stabilizing the heart muscles by give the patient calcium gluconate 10% in 10 minutes slowly to to protect the heart, and then can give the patient insulin with 50% glucose, like 10 unit insulin to enhance shifting of the potassium from outside to inside the cells. Also can give the patients beta agonists like salbutamol, also enhancing the shifting of the potassium.
Yes.
And I can give the
Where do you think this patient is the ideal case to be managed?
This patient have a sign of peritonitis and old age, better to treat it in intensive care unit.
HDU, yeah.
Okay, HDU.
Who would you involve in the management of this patient?
Okay, the surgeon and also the stoma team, and also patient dietitian and
geriatric
geriatric doctors, infection control also,
infection control
because patient
and patient's own GP. Good.
Yeah, patient maybe
Good.
geriatric.
Very good. Okay. Maybe last one can be asked about the antimicrobials, which ones to be given.
Okay,
Would
I
you
will give the
wait
patient
for the cultures to come back, or you'll
no, patient on sepsis, better to give in the first hour the antibiotic.
Yes.
I will take the blood for the culture and start empirical antibiotic, give like augmentin or what, I forget the natural name. I can give clindamycin to
okay, yeah.
Okay, amoxicillin to give cover the positive, and give clindamycin and to cover the negative.
Very good.
Sorry, to give her an anaerobe and give I forget the name of negative.
Best